Supervised consumption sites aren't new. In fact, the first one in North America opened in Vancouver more than 20 years ago. Yet for many, they're still a little mysterious. What happens inside, and how does it work? Well, it's been a while since we've been granted access inside of a supervised consumption site, so we've come to Surrey to take a tour.
Hi, great to meet you.
Nice to meet you, Joel.
Erin.
All right, so we are out front of Safe Point here in Surrey. Let's start with the easy question first. What is Safe Point?
Yeah, so Safe Point is a supervised consumption site that opened in 2017 to witness consumption of substances. It's a federally exempted site. So folks would come up here and they would buzz in, and but I have a card, so yeah, we'll come on in. Yeah.
She says more than 170 people access this supervised consumption site a day.
So they arrive, they give a unique identifier. Some people might call it a handle, but then it will pull up a bit of information about them. It's completely anonymous and not connected to any other health care services.
Response emergency, overdose.
In 2016, the overdose crisis prompted the province to declare a public health emergency. Since then, the BC Coroner's Service says more than 13,000 have died. At Safe Point, Gibson says people can access free harm reduction supplies, like needles, syringes, and pipes, among other things, to ensure the equipment they're using is clean. For privacy reasons, Fraser Health let us tour the facility before it opened to the public for the day.
All right, should we check it out?
Yeah, come on in.
This is the consumption area. Individual booths line a wall, where Gibson says people can consume their drugs under the supervision of trained healthcare professionals.
What's the benefit of having staff right here while this is happening?
Yeah, so the staff, they can sit here, but they're often connecting with people and chatting with them in a more intimate kind of conversation. They're here to be supportive, caring witnesses who are trained to be readily respond in the event that people start to have a toxic drug poisoning event.
Since this site opened in 2017, Fraser Health says staff have reversed more than 3,000 overdoses. And over the last half of a year, there's been an average of about 9 overdoses a month. Gibson says it varies with the toxicity of the street supply.
Why does a site like this matter?
Harm reduction provides a place for people to connect and be cared for. Substance use remains one of the most highly stigmatized things in community, and so people will often they will isolate and they use alone, and then that's when we see adverse outcomes and we continue to see the high rates of overdose death.
One of the big concerns that we often hear around consumption sites, especially because for a lot of the public there might be a little bit of mystery around it, is, oh, people are getting free drugs at these sites. Does that happen here?
Yeah, so people bring their own previously procured substances and they bring them here to use under trained witnesses.
People do not buy or receive illegal drugs at a safe consumption site. However, Gibson says they can test their drugs to ensure they aren't tainted. And while here, she adds that people can also be connected to other services, like addiction clinics, shelter spaces, and basic wound care. Fraser Health says through Safe Point, more than 580 people have accepted referrals to other healthcare providers and social services. Supervised injection is just one of the services here. This area is an inhalation site.
So we've really seen an increase in the amount of inhalation use over the last 5 to 7 years. I think that that's sort of a testament to the change in the drug supply. And
has inhalation become more popular than injection at this point?
I would say so. Yeah.
And I guess what are the challenges of now also dealing with this boost in inhalation compared to just injection?
It's hard to find spaces that are appropriate for witnessed inhalation. In terms of they're also outside often, and so it makes it really difficult for some of the other parts of the province to have spaces that are accessible, especially when you're dealing with -30.
The Safe Point supervised consumption site sits in Surrey's Whalley neighborhood. surrounded by community centers, a park, and homes.
Whenever consumption sites open, we often see that there's some resistance, of course, from the community. What makes a community a good area for a consumption site versus another part of the community?
I think any place where you're seeing levels of unregulated toxic drug poisoning events is a good place to have it. It's understandable that communities have a lot of questions, so they're here to enhance safety, reduce the public consumption of substances, connect people to services, build and be a part of building an inclusive community.
Yeah, there's often lots of concern that opening a supervised consumption site like this or an overdose prevention site is going to increase public drug use in the area. Does that happen?
What we know from the evidence and the research is that it actually can reduce public disorder, public consumption, and reduce impact or reduce calls for service for police and fire.
Since opening, she says there's been a reduction in the number of public overdoses within a 500-meter radius of the site, and there's never been an overdose death at SafePoint.
What does the future look like for supervised consumption sites, at least within Fraser Health?
We're looking to provide equitable regional access to witness consumption services as a standard part of healthcare. In all of our communities, it's an important life-saving service.
But for now, SafePoint remains the only federally exempted site in the entire Fraser Health region. Joel Ballard, CBC News, Surrey.